Okay, I'll tell you guys right now, the urinary chapter is very, very heavy on the images. Like I told you guys for OB, there was a chapter that's pretty heavy on images. This one's pretty heavy on your images here, okay? Make sure you are able to identify the normal aspect of a kidney. You should be able to identify the renal cortex versus the medulla. You should be able to point out paraments. Those are all normal anatomy of a kidney, so you should be able to point those out. So here, are we looking at an image in transverse or sagittal? Transverse. You can clearly see that you have a kidney that is C-shaped. Coming off of the IVC, you have the renal vein going in, so this is a transverse view. Same thing here, this is a superior pulp, it's still a transverse view. So all of this is a renal cortex, the center part is your medulla. So here's a good example, here's a renal cortex, here's the medulla in the center, and you can see a renal parament, a very prominent renal parament right here. So on this image right here, all of these hypoechoic structures are your renal paraments. So again, just be sure you go through your normal anatomy. Remember, in a longitudinal view, this muscle behind the kidney is the psoas muscle. Remember that even in lab, remember that behind a kidney, if I point out a muscle, the only muscle you guys have learned that you can see on ultrasound behind the kidney is going to be your psoas muscle. I'm going to skip over these because these are just showing you again your normal examples. What are those hypoechoic structures right there? Those are pyramids. Okay, next we get into variants. Okay, so for variants, the first one we are looking at, you can clearly see we have this prominent cortex that's dipping down, making this what? Column of Vertin. So anytime in our normal patients, we do have column of Vertins. All of this between the pyramids are column of Vertins, but with a variant, you have an enlargement of that and it kind of dips down. The key point here, if I were to ask a variant, it will be in the question. That way you don't get it confused with the pathology. What is the normal variant that you're seeing in the image? That should make you think of these. Okay. Here we are looking at the fact, if you look at the top, you can see that the kidney, instead of having a smooth border, it has kind of like this hump right here, right on the outer portion. And that is your dormitory hump. All that is the cortical bulging out a little bit due to some sort of a compression that occurred in your embryological state. Okay. Remember that the echogenic bright structure seen within the kidney, that is your junctional parenchymal defect. These are seen in both views. You can see right here you have this triangular structure, and then over here a triangular structure. Again, these are normal variants. Here's another one you can see. If you look at the kidney right here, you can see the borders are kind of lobulated. Remember that for pediatric patients, it's very common to see lobulated kidneys, but in adults, it's not present. Sometimes this variant can be present where you see these lobulations. Next one we have is your extrarenal pelvis. So if, for example, I've got this clear image with color Doppler proving that this is not any sort of vasculature, right? If this vasculature would light up, that proves that this is an extrarenal pelvis. So you can see it right here as well. Outside of the kidney, there's this bulging effect, and that is what we are seeing right here. Next we get into your renal anomalies. So here we're looking at, firstly, this is a malrotated kidney because you can see that it's kind of laying on its back instead of being flipped the opposite way. You can clearly see the kidney is a lot more superficial than we are used to seeing it. This is a good one, that your double collecting system. Remember that from the cortex to the opposite cortex, this is going to be a complete connection, creating these dual or double collecting systems. So next we get into what is this within the bladder? If this is a bladder, what is this echogenic structure seen within the bladder? Urodocele. Everybody should be able to identify those at this point. If I'm giving you an obvious image like this is when you can see you have one kidney right here and one kidney right here. You can clearly see both kidneys are on one side, so there is an ectopic kidney present there.
Would you consider that one a cross fuse?
Correct. The rest of these, honestly, the cake kidney, the horseshoe kidney, it's very difficult on ultrasound, so I will not be putting those images there. Okay, so again, what these double echogenic structures within the bladder? Again, those are bilateral urodoceles. Okay. Here again, we are seeing a urodocele. You can see a urethral jet going off. That's that echogenic line that is being pointed to here, but a significant size urodocele. Okay, next we get into cyst. If I give you a simple cyst, complex cyst, solid cyst, be able to sonographically describe those to me. Okay, that shouldn't be hard. Remember, simple cyst, you got thin walls, it's completely anechoic, it's more rounded, posterior enhancement. At this point, that should be pretty simple to all of you guys. Okay. The more lobulated the structure gets, the more the uneven borders. It's no longer circular. You can see the internal complications. It's got debris within it. We still have posterior enhancement, but this is a complex cyst. Next we get into polycystic kidney disease. If I were to give you an image that is completely covered with cysts, like any of these images, remember that is polycystic kidney disease. Again, both of these images, you can see all of these cystic structures taking over the entire renal parenchyma. The actual renal parenchyma gets really difficult to visualize, and all you see are cysts. Here's a really good example. You can see that the entire kidney, we can make it out, but all of it is taken up by these multiple cysts that are seen throughout. Go ahead and skip a few over here. Next things I want you guys to be familiar with . Okay, next one, renal angiomyolipoma on page 409. Make Make sure you are familiar with those. This is an easy pathology. You can see bright echogenic structures within the actual renal parenchyma. You can see right here. These are very, very bright. It pretty much resembles the sinus brightness. This is a clear example of renal angiomyolipoma. Okay, next we get into hydronephrosis. That's another easy one, regardless of an image. Whatever image I give you, you should be able to pick up hydronephrosis. Remember, all that is fluid being retained within the kidneys, whether it's specific to just the kidneys or the ureters are dilated. Regardless, it is hydronephrosis, right? You can clearly see here the calyces are dilated as well as the renal pelvis. The ureter does not seem like it is dilated, but this is still an example of hydronephrosis. This one is showing you that there is a ureter dilation, and then we had a stone that's lodged within there, and you can see that shadowing coming off of that stone. Okay. Here's a really good example. You can see color Doppler, and all of this is just fluid retention, so that is all hydronephrosis. Here again, you can see hydronephrosis present. You can see the kidney. And all the calyces as well as the renal pelvis is dilated. Remember, the kidney starts kind of looking like that cauliflower appearance is what the book talked about earlier. Skipping quite a lot. Don't even worry about looking at the images that I'm skipping over. Okay, when it comes to kidney stone or urolithiasis, remember all it is a calcified stone present anywhere within the kidney or the ureter. It will be bright and echogenic. Posterior to it, you will have shadowing. Here's another example, smaller stone, but it's still a stone. Okay, it will be bright and echogenic. You can see all of those. And remember, with them, we do get this artifact with color Doppler, that twinkling artifact. Right? Some of you guys that are in the first lab were able to see Kim that has a stone. When we put color Doppler on it, it does create that twinkling artifact. Okay, that's going to be it. And as far as the transplant section, let me make sure before I say it. There will be no images from the transplant section. So just chapter 15. Okay, but focus pretty heavily on chapter 15, guys. There's lots of images from here. Okay, so next chapter we're in so retroperitoneum, which is chapter 16. Okay, with chapter 16, remember one of the biggest things in this chapter, we looked at the difference between an adrenal gland and a kidney. It's very common to confuse one for the other, especially with our younger patients, so be sure you're able to identify them. This is showing you a normal kidney. You can see those pyramids that are present on the actual cortex. And this hypoechoic Y or V-shaped structure right here is an adrenal gland. Okay, be able to identify those normal structures. Here's more examples of it. You can see here's the kidney, and right adjacent to it, this hypoechoic structure is an adrenal gland. Here's a transverse view. Here's a kidney, and here's the actual adrenal. Just remember, next to the kidney, if this is a normal structure, that is generally going to be an adrenal gland. The other thing we looked at in this chapter were your lymph nodes. So remember, lymph nodes have kind of this, they are circular, they are hypoechoic, they're not completely anechoic. They do have a little bit of an echogenic center, but again, these are all showing you lymph nodes or para-aortic lymph nodes that are present. Okay, next thing, adrenal adenomas. That's another one I want you guys to know. With adenomas, remember, it creates more of that halo on the outer aspect. So if you look right here, you can see the outer halo that's present even on this one, meaning that you're able to differentiate the adenoma from the actual normal anatomy. Okay, so remember this pathology when it comes to an adrenal. Here's another one that I want you guys to know. Given the fact, okay, here's liver, here's kidney, here's IVC. This is a mass on the adrenal region, and you can see that the isoechoic echotexture compared to the liver. These are all indication that this is your phoebocryptocystoma, okay? So that is another one. Because of the fact that it is so distinguishable, I want you guys to be familiar with those ones. Okay. And that is going to be it for this chapter. I lied. Go back. Your retroperitoneal fibrosis or Armand's disease, regardless, whichever one you want to remember, be sure you are able to identify them. The images in your book are not the best. The images in your book are on page 448. You can see that there is that fibrotic sheet that's surrounding the vessel. So if you look right here, here's the actual vessel, and all of this around it is the actual fibrosis. Again, in longitudinal view, here's the vessel, and all of this is the fibrotic tissue. So these are good images right here, and this is obviously at the bifurcation, and again, you can see all of that is the fibrotic tissue. So that is retroperitoneal fibrosis, also known as your Ormond's disease. Okay. Next, we get into the peritoneal cavity, chapter 14. Okay, in this chapter, one of the biggest things, obviously, you should be able to identify your pleural effusion versus ascites, etc., etc. So here you can clearly see, here is the diaphragm. So this is liver right here, meaning this is lung tissue, and all of this would make it pleural effusion versus ascites, right? It's clearly around the lungs. It's above the diaphragm, though that is pleural effusion. Everybody okay with that? Okay, next we just look at ascites and fluid collections. So again, all of this is the liver. You obviously have kidney here, and around the liver we can see lots and lots of ascites or fluid that's collecting around that. So that is true ascites. Here you can see ascites, but it has become loculated. You can see all those septations, loculations running through that acidic fluid. Okay. Urinoma is the next one that I want you guys to be familiar with. Remember, urinoma is just a urine collection creating this cystic presentation. So here you can see, here's the right kidney, and all of this is an example of a urinoma. So you've got all that urine collecting into this large cystic space, presenting as a urinoma. So be familiar with that one. And that's going to be it for that chapter. So 14 and 16 are not that many images, but be sure to review the ones I told you guys. The other heavy one is definitely your thyroid chapter. Which, as a reminder today, guys, we do have your imaging in that. Therefore, you guys should have studied all the images. You should be fine. Okay, so remember all your normal structures of a thyroid. What view are we looking at the thyroid in this image? Sagittal view. Remember, you should be able to differentiate your sagittal from transverse. This is your transverse view. So here is the right lobe of the thyroid going through to the isthmus. This is the carotid, and here is your internal jugular. The vessel right next to the thyroid, touching the actual thyroid, is the carotid. The vessel more lateral is going to be your internal jugular vein. Here's another view. Again, you can see the thyroid lobe and then the two vessels. So this one would be the carotid, this one would be the internal jugular. So this is showing you both right lobe going into the isthmus, going out into the left. Both, this is the carotid, and this is the carotid right here. Again, showing you normal flows. All of these are normal images of the thyroid. Make sure you know this image. When it came to muscles, I specifically told you guys study your muscles off of this image because the images that your book laid out, there's too many errors on that as far as muscles. So do not study the muscles based on your book. So just as a review, this is showing you the left lobe of the thyroid. This is the carotid artery, and then your jugular vein. Remember, right above the thyroid, the muscle that's actually touching the thyroid is called what? Sternothyroid. Above the sternothyroid, we have the sternohyoid. Lateral, right above generally the jugular region is where you're going to see the omohyoid. The large muscle above all of those, all of this is what? Sternocleidomastoid. And last one, right underneath the thyroid gland, underneath that jugular vein, your carotid, all of this right here is what? Longus colli muscle. So make sure you are familiar with those muscles. Okay. This image, You guys just know everything for this image. I'm telling you right now. Okay? Okay, next we get into nodular diseases. Remember, nodules can be multinodular, single nodular masses found within the thyroid tissue. So you can see right here, here is a large nodule that is found on this thyroid, and you can clearly see that hypoechoic region around it. That is very common to see with a nodule. Here you can see that the entire thyroid definitely looks like it is enlarged. Here you can see firstly look at the isthmus. You definitely see lots and lots of, it's thickened, right? Both of the lobes of the actual thyroid definitely look like they are enhanced. It's definitely larger. So this patient definitely had they had a goiter present that was causing that enlargement. Here is another example. You can see you've got one nodule here, one nodule here, one nodule here. So you've got multiple nodules running throughout this thyroid tissue. Here's another example. You can see we have one nodule right here, and then if you look down here, you've got another one, and even one up here. So all of these are showing you your multinodular thyroids.
Those last images were longitudinal.
This one is actually transverse. So if you look right here, this is the actual isthmus. Look behind, here's the esophagus region right here. Esophagus, trachea, and then this is the transverse lobe. Also look right here, you can see that the vessel is circular, so it's a transverse view. In this view, this is a good example of your multinodular thyroid. If you compare the right to the left, you can definitely see the right side is extremely enlarged compared to the left. Regardless, we have multiple nodules. There's one here, there's one here, and then when we go to the left side, there is one on the left side as well. Next we get into benign lesions. Remember, just simple cysts. So this one is showing you a simple cyst. You can see that's completely anechoic, got thin walls, a normal anechoic structure. Versus this one here is showing you your colloid cysts, which are specific to thyroids, and they will be anechoic. However, you will see this echogenic foci running through them. When it comes to malignant processes, what was one thing that we specifically talked about that we want to know? When it comes to the appearance of any sort of malignant structure for the thyroid, how will it appear? Taller rather than wide. So make sure you remember that if I give you a sonographic example, and I specifically show you a mass that's taller rather than wide, and I'm asking if that's malignant or not, that's what I'm referring to, okay? So be sure you are able to identify those ones. So for example, right here, you can see that we have a pretty tall lesion right here. So that's an example of a malignant lesion. Again, anything I give will be something that's very, very obvious. Okay, next we get into diffuse diseases. Anytime a thyroid is diffusely enlarged, what is the most common diffuse disease process of the thyroid? Hashimoto's, right? So any sort of diffuse enlargement, meaning I'm not able to distinguish why it is enlarged. It is just enlarged. That is going to be either Hashimoto's. What's the other one? Graves' disease, guys. So just be familiar with those two. Here's an example of Hashimoto's. You can see overall the thyroid just looks very ill-defined. Like the tissue texture is no longer smooth. It appears very complex. It definitely looks like the thyroid is diffusely enlarged. Specifically, look at the isthmus. You see how it like gets this bulging effect right there? That's proving that the thyroid is definitely enlarged. You can see that overall that the epitextures are no longer smooth. This is an example of Hashimoto's. Okay, so remember that. Which is Hashimoto's more common in males or females? Females. Okay, so that's another thing. If I give you a scenario, if I'm giving you things like, okay, this patient was female, you've got a diffusely enlarged thyroid, then that should link you to Hashimoto's. Yes, ma'am.
Was there any of them that were
I think there was, what was that?
The anaplastic.
Yeah, the anaplastic one was the only one that's for the thyroid that's more specific to males. Okay. Here's another view of it. What view is this in? Longitudinal or transverse? Longitudinal. You can see that. Look at the thyroid gland. It looks very lobulated, right? We lose that smoothness of the actual gland. Overall, it just does not look smooth throughout. It looks very lobulated. We do have a prominent lymph node as well right here. So again, this patient did have Hashimoto's.
Can you tell that's a lymph node and not a parathyroid enlargement?
They look the same quite literally in that image. I wouldn't be able to tell you had they not labeled it as a lymph node. But if you were scanning live, if you see that echogenic stripe running through the center, then it's a lymph node. Okay. And I believe that's going to be it for this chapter as well. Don't worry about your parathyroid glands. Since we don't scan them that much, I don't have any images for those in there. But please be familiar with your thyroid. Make sure you know normal thyroid as well as pathologies when it comes to thyroid. Okay? Any questions on those guys? Okay. Before I give you a break, let's go through the OB quiz that you guys just took.